They basically said it'd be £1,000 an implant, between £16,500 to £27,500, and that's over a year of wages for me.
Would you travel 2,000 miles to go to the dentist? Rising numbers of Brits who can't get an NHS appointment but also can't afford to go private in the UK are coming here to Turkey, not for veneers and vanity, but for rotten teeth and root canals. Over the last year, around 6 million Brits have been in long-form tooth pain, but getting an NHS appointment, particularly if you're a new patient, can be next to impossible, with some clinics reporting waiting lists of up to 10 years. And figures suggest 1 in 10 Brits have attempted some form of DIY dentistry, including trying to pull out their own teeth in desperation. Despite warnings about the risks of getting treatment abroad.
I took actions into my own hands and basically put a really thin shoelace around my tooth and garroted them out, so it went round the base and it pushed it out like popping peas.
61-year-old plumber Grant Lakey from Southend had to resort to extreme measures after not being able to get the dental care he needed on the NHS.
I had an accident at work and I actually lost one of my teeth, and it started moving, and then all of the teeth started moving in a sort of like towards the gap, and then obviously if they're not supporting each other, they started to get loose. While this was all happening, I was trying to get a dentist appointment where I lived in Bromley at the time. I couldn't get one for love nor money around there. Then I decided to look private. Again, couldn't get anything private, and the cost was just ridiculous. It didn't seem to me as if there was any duty of care. I mean, I was just distraught. It just looked terrible, and everything was moving in my mouth, and it was just awful. Because the quoted over here, like I said earlier, it was like £28,000 to £30,000, and you're thinking, I can't afford that. No working man can afford that.
In desperation, Grant pulled out his own teeth.
Yeah, she's not clever, and I got infections, which didn't help. So I was on antibiotics, which is not great, but stupid, foolishly, but yes, I was in that much of a frenzy. I had to do it.
Feeling out of options in the UK, he turned to dental tourism and joined the rising number of Brits going to Turkey for care. The government accepts services need to improve here, but they also say they have very little power to help if things go wrong abroad.
So a range of interventions here in the UK. Obviously, what we can do in other overseas jurisdictions is very limited.
Figures from the British Dental Association suggest that nearly 90% of UK dentists have treated patients after procedures have gone wrong in other countries. And whilst dental clinics in the UK must meet strict standards, the quality of care can vary provider to provider in countries like Turkey. One of those taking that risk is 30-year-old mum of 3, Chloe Taylor from Cannock. She needed multiple teeth removing after her third pregnancy, but the temporary dentures the NHS gave her didn't fit properly.
I didn't want to leave the house. The only time I'd leave the house was to take the kids to school or to go to work. Other than that, I wouldn't go out round the shops or anything like that. I wouldn't go on a girls' night. I just wouldn't leave the house. I asked about implants. They basically said it'd be £1,000 an implant, which as a single mum isn't doable really. So you're looking at more like £2,000 a tooth.
So what was the kind of total that you were being quoted at that point?
Between £16,500 to £27,500, and that's over a year of wages for me.
As a last resort, she got quotes from dentists abroad, settling on Istanbul, where she's paying £9,000 for the work. And despite the possible risks, Chloe felt she had to take action to fix her teeth.
I did weigh up my options and I thought, do I just go through life without teeth, stay in the house, become this hermit of a person, become a shadow of myself, or do I actually go out, do the research, get different quotes from different places, not just Turkey, but there's like Austria and places like that do it as well.
Turkish operator Dentakay says they've seen a huge influx in Brits travelling to their clinics for treatment, up from just 15 in 2019 to 6,000 last year. Dr. Johnson leads one of their teams of dentists. She says they see patients from all over the world, but says Brits have the worst teeth.
Actually, some of them are coming, extracting the teeth by themselves. Those are very dramatical cases. We saw them, and some of them not brushing very well. But lots of them have lots of damages on your teeth. There is lots of cavities, lots of root canal needing, infections, lesions on their teeth, and no one did anything. So it's shocked for us also, because in Turkey it's not like that. Somebody needs extraction, it has to be done in the dental chair actually. No one can touch it. So it's very risky, but it's very popular in British people. We saw lots of cases like that.
Dental tourism from the UK really boomed because of a huge care backlog post-COVID. But with British dentists now picking up the pieces when procedures go wrong abroad, the government is working to flag the dangers.
Well, too many people are suffering life-altering injuries because of taking up these offers of dental care in situations that are not properly regulated. And where the medical practitioners are not properly qualified. So we are working to ensure that there's greater awareness of the risks associated with this. Obviously, what we can do in other overseas jurisdictions is very limited, but we are doing some of these campaigns and awareness raising on social media to just try and make sure that people are really, really careful and think really, really carefully before they do travel overseas for these procedures.
So a lot of people are travelling for restorative dental work because they cannot get an NHS appointment here. So things like they're in pain or need root canals. What does it say about the state of British dentistry, NHS dentistry, that they are either having to resort to pulling their own teeth out in some cases or having to spend thousands travelling abroad?
We inherited a dentistry situation, NHS dentistry in crisis, demand for NHS dentistry going through the roof, and yet there was an underspend on the contract, and there's all sorts of terrible outcomes for people, just as the ones that you've just outlined. So we are taking immediate action. We've got 700,000 urgent dental appointments now being provided per year for the rest of this parliament across the country. We've got a supervised toothbrushing programme for children.